welcome Dr. Ezamanari M. Obasi, Vice President for Research and Innovation at Wayne State University.
Well, first off, I want to start with a good afternoon. Oh, really good energy today. I love it. I love it. So I guess I don't have to introduce myself since I was virtually introduced, so that's awesome. But I do want to welcome everyone to Wayne State University and really want to highlight how special of a day this is for us. I would first like to have you join me in recognizing the staff and the university relations, as well as our planning event team for this wonderful celebration. If you're in attendance, can you please stand? I also want to welcome our local and state leaders and officials. If you're in attendance, if you can please stand so we can recognize you. So as a Carnegie One Research University, our faculty are in the business of tackling problems that impact our community, our state, and the world. With this new 160,000 square foot state-of-the-art building, that will be the place where we will stand up this site. We will be arming our faculty with the latest technology and tools to advance their work in the health sciences. Our faculty have been doing high-level research for a really, really long time. And these new faculty will allow us to enhance and accelerate that work. It will do that by encouraging collaborations between researchers in multiple disciplines and giving them centralized access to cutting-edge laboratories and core facilities that will accelerate groundbreaking breakthroughs. This building will allow for research by faculty in many of our schools and colleges, and its location will allow seamless connection with existing spaces already in our medical campus. You will be able to cross over through a pedestrian bridge to Scott Hall, and we will also have, on Canfield Street, and a walkway to Element Building, which is next door. In short, this facility would be a game changer for Wayne State. It gives us the capacity to advance the future of health sciences by driving discovery and innovation and rapidly translate it back into the community who deserves it. You will hear from others today about how this new facility and research conducted inside these walls will impact both our city, our county, and our state. And with that, I just want to thank everyone for being here. Thank you.
And now, ladies and gentlemen, let's welcome the chair of the Wayne State University Board of Governors, Shirley Stancato.
Good afternoon. On behalf of the Wayne State University Board of Governors, I'm really honored to bring you greetings and to welcome you to this historic occasion. There's another member of the board here with us this afternoon, Governor Sonny Reddy. Sonny, will you stand, please? Thank you. Today, as we break ground on the Health Sciences Research Building, we're not simply celebrating bricks and mortar. We're celebrating a bold step forward in Wayne State's mission to improve the health and wellness of Detroiters, Michiganders, and communities far beyond. Just as Wayne State stands at the heart of Detroit, Detroit has always been at the heart of Wayne State, shaping our values, inspiring our mission, and driving our vision. This new building represents the next chapter in a legacy that began more than 150 years ago when the Detroit Medical College was founded in the wake of the Civil War. Those early physicians understood that healing, discovery, and education must go hand in hand if we are truly to transform lives. That founding vision is alive and thriving today. Wayne State's faculty, researchers, students, and community partners are on the front lines of discovery, working every day to confront health disparities, pioneer medical breakthroughs, and bring hope to families across our city and our state. Wayne State also has had an impact that's been felt around the world, from pioneering breakthroughs in HIV treatment to the first use of a mechanical heart pump in open heart surgery. This new facility will give our researchers the space, tools, and collaborative environment they need to accelerate that work from bench to bedside to community. The Health Sciences Research Building is more than a structure. It's a promise to Detroiters, a promise to Michiganders, and a promise to future generations that Wayne State will continue to lead with innovation, compassion, and impact. It is an investment in healthier neighborhoods, stronger families, and a brighter future for all. As the Board of Governors, we are proud to support this transformative project. We look forward to the discoveries and solutions that will emerge on this site, discoveries that will not only strengthen our university, but uplift the lives of countless people. So on behalf of the Board of Governors, thank you for being here today to share in this important milestone.
Ladies and gentlemen, please now welcome the 13th president of Wayne State University, Dr. Kimberly Andrews Espy.
Good afternoon, everybody. Thank you, thank you. I am so proud to be here for the groundbreaking of our new Health Sciences Research Building. Today is a truly remarkable day for Wayne State and for Detroit and for Michigan. This $200 million investment will transform how we advance health, research, education right here from the heart of Midtown. I am so grateful that so many leaders and colleagues and friends have joined us here today, and we appreciate your partnerships with our city, our county, and our state in the planning and development of this project, one that will have such broad and deep impact on so many well into the future. The Health Sciences Research Building will be a hub of innovation and collaboration, where researchers, clinicians, and students and community partners address our most pressing health challenges. As Governor Stancato mentioned, while this building may be made of brick and mortar, it represents momentum, it represents partnership, and it represents Detroit, truly a city on the move. As Detroit's hometown university, Wayne State has worked hand in hand with our city partners for more than 150 years. And with this new facility, we will be writing the next chapter of our collaboration. Strategically located right across from the School of Medicine and adjacent to our many partners, this building will spark collaboration and for many exciting discoveries that we can move quickly from the laboratory to the clinic. Students will gain transformative college-to-career experiences that prepare them for tomorrow. Community voices and needs will shape these breakthroughs to benefit Michigan families. Wayne State is a national leader in university research and discovery, holding the Carnegie Foundation's top-tier Research One ranking for more than 30 years. I'm particularly proud that this last year we clocked a campus record in sponsored research, an all-time high of $292 million. This milestone, yeah, exactly, there you go. This milestone reflects the leadership of Dr. Abbasi and the Dory support team, the collaboration of SVP Costello and Provost Clabo, and is derived from the quality of the work done here by our faculty, students, and research staff. Understanding Alzheimer's or bipolar disorder in children, developing new cancer treatments or vaccines that improve the health and resilience of our residents. This building will help us do even more. At Wayne State, research is about advancing science, but most importantly, it's about advancing lives. We address persistent and stubborn disparities in health outcomes with urgency, and we invite our community members into our research processes to ensure that discoveries reach those who need it the most. That's what an urban-serving, top-tier public research university does. And tomorrow, stay tuned for another announcement, we will kick off a new Grand Challenges initiative that will bring this building to life. What an exciting future ahead. Now, we are grateful for the state of Michigan's $100 million commitment to this endeavor. Governor Whitmer's support affirms Wayne State's role in empowering health and fueling economic growth. This building will create jobs, will attract top researchers, will fuel innovations and new startups, and ensure that Detroit remains a place where discovery thrives and opportunity grows. Now, none of this is possible without the collaboration among our schools and colleges and our health partners like Karmanos Cancer Institute, McLaren Healthcare, Detroit Medical Center, and many, many community health organizations that are represented here in the audience. Now, you all can get involved too. There are many remaining philanthropic opportunities to recognize a loved one or to support a cause that you care about. And in fact, this year, we are on track again to hit a university record of more than $130 million in gifts. This is the generous spirit that defines both Wayne State and Detroit. Now, Wayne State is ready to meet the challenges of our time alongside with our partners in this great city, region, and state. Together, we are breaking ground on a new building, but we also are breaking ground on a future of health and opportunity for Detroit, for Michigan, and for the world. So let's continue to move forward together to empower health for our urban neighborhoods. Thank you all very much.
Ladies and gentlemen, now please welcome Elizabeth Hertel, the Director of the Michigan Department of Health and Human Services.
Good afternoon. Thank you so much for inviting me to be part of this such an important event. I'm so excited to be here to support this. The Michigan Department of Health and Human Services' highest priority is supporting the health and well-being of Michiganders, and we are so lucky to have a great partner in Wayne State University for that. This innovative hub is going to be the central point in discovery in Southeast Michigan, in the state, and in this region for years to come, due to the development of this building and the commitment of the leadership at Wayne State University, the communities around, and the state of Michigan. I'd also like to acknowledge the support of Governor Whitmer in making sure that we continue to expand our research capabilities, support the healthcare and opportunity for our communities and our neighborhoods, especially in areas that are underserved, and really focus on the commitment and the partnership of our community providers, some of whom are represented here today, who are really leading in this space of uplifting our communities. I'm looking forward to seeing what comes out of all of the research here. I know the opportunities for students, researchers, and the community are going to abound, and I'm really, really excited to see what comes. So thank you again for inviting me, and congratulations on this development.
Ladies and gentlemen, now please welcome the Wayne County Executive, the Honorable Warren Evans.
First of all, thank you very much, and it is a great day, really. This is something that Wayne County, the city of Detroit, has needed for a long time. We are very, very serious in Wayne County. We have 1.8 million people, and in some health science categories, we're not outstanding. What needs to be outstanding is the research that helps us solve many of these problems. I also have to say that Dr. Espy has been a collaborator. I think she believes that collaboration is the new currency, and I think it is. It is very important that outstanding universities like Wayne State University see the connectivity with the city of Detroit, the county of Wayne, our health department, the needs that we have. I mean, we worked very diligently in Wayne County to work on air pollution issues. You probably hear me all the time about pollution in our landfills and those sorts of things. Well, a research university that can speed up the evaluation and come to conclusions in a reasonable amount of time is extremely important, and I can't minimize that. I am so excited that the university that's always been a great university, I see developing more connectivity to the partners out there who also have a responsibility for the health and welfare of the citizens. So I'm excited. I'm not in the construction business, so I can't help you build it. But I can certainly laud your efforts and work with you in the future to solve serious health problems. So thank you very much for the invitation, and thank you very much, Doc, for being a partner. Thank you.
Ladies and gentlemen, here is the mayor of the city of Detroit, the Honorable Mike Duggan.
Well, I had to be here to say congratulations to Chair of the Board of Governors, Shirley Stancata, the President, SB. As you know, I got a lot of history in this neighborhood and see so many old friends still here. But the history means a lot. Wayne State started off as the Wayne Medical College. It was a medical school before it was a university, and the medical school has been what Wayne has been known for nationally for a long time. It was on this campus in the 1950s that Wayne State Medical School doctors partnered with engineers for General Motors to start heart bypass surgery in this country. It was on this campus that the first treatment for AIDS, AZT, was developed right here. And more recently, it was on this campus in partnership with the National Institute of Health that Wayne pioneered treatment, something kind of close to home for me, in prenatal care, reducing preterm birth and infant mortality. This has been a national leader. But if you are going to continue to be a national leader in research, you need the finest facilities. And this is remarkable, isn't it? With the state's help, what Wayne State is building, and here's the truth. A lot of the top faculty that you want, a lot of the top students that you want, a lot of the top residents and fellows that you want to go beyond treating patients. They want to develop the cures and the treatments of the future. This is going to allow Wayne State to continue to attract and retain that type of talent. And to get this $200 million investment in Midtown. And I still laugh about that. 25 years ago, if we had stood here and said the phrase Midtown, nobody would have known what you were talking about. There was no Midtown. Midtown started when Wayne State decided to convert from a commuter school to a residential school. And when they started building residential dorms, there were people who thought the university leaders were crazy. Nobody would want to move into the city of Detroit. The Midtown that we know today was because of the vision of Wayne State University in building out this area. And when this kind of $200 million investment, we have got to be building the city and the state where our most talented young people want to come and want to stay and live. And these are exactly the kind of jobs, health sciences and research jobs, that we need. This is a great day for Wayne State University. It's a great day for the city of Detroit. And I just want to say congratulations.
Ladies and gentlemen, next up is Wayne State University's Senior Vice President for Health Affairs, Dr. Bernard J. Costello.
Good afternoon, everyone. I am so excited to hear all this enthusiasm. Who wouldn't want to be a part of the transformation of this city, Midtown and otherwise, and do it through things like this building? It's really a wonderful thing to be part of this groundbreaking and a very important development for the health sciences, for Wayne State, and also for the community and our engagement with that community. As you might imagine, as the Senior Vice President of the Health Sciences, it gives me a unique view to really see Wayne State's enterprise in its full capabilities. And from the President's prosperity agenda, particularly our goal of empowering health, to innovation led by our incredible faculty and researchers, to the state daily student experience of our health sciences programs, I get to see the whole constellation of that activity. And I also get to see how that activity translates into meaningful impact and better health for our community and beyond. It's one of the reasons I came here. I'm 8 months in, and this has all been affirmed. This university has a very, very strong tradition of excellence, not just in health sciences education and innovation, but in collaboration and in partnership. There are countless examples I can talk about, but very briefly, let me just mention three. First, our community-engaged research, and it's present in this beautiful building on the first floor. Wayne State is a leader in this space, no question. Our decades of authentic interdisciplinary work, putting community at the center, making us the envy of many institutions across the country, is really something special. And by partnering directly with those who we serve, our research becomes more relevant, impactful, and trusted. Second is our commitment to clinical partnerships. At Wayne State, we recognize the value of partnering with our clinical affiliates that connect our academic research to real-world health solutions, like the Carmanos Cancer Institute and the McLaren Health System that we're partnering with inside this building in oncology cancer research. These relationships give students hands-on experience and exposure to diverse clinical roles. Third and finally, collaboration. Simple word, very powerful results, and very important to us. Our students learn from the healthcare as a team effort, and where our multiple professions work together in a person-centered model, that builds a collaborative mindset, one that really delivers care throughout their careers in that fashion. So this health sciences research building will provide a physical hub for all of those things, sure, for engagement, for partnership and collaboration, but it's so much more than that. It's our warrior identity to do so, and we know that from the very beginning from 1868, as was mentioned. This building is a physical embodiment of that identity, and it's a signal to the community that we're not waiting for the future of healthcare to arrive. We're building it right here, right now. Thank you.
Ladies and gentlemen, please welcome Mr. David Underwood, the Managing Director of the Detroit Community Care Network.
Good afternoon, everyone. Well, first of all, I'd like to say it's a tremendous honor for me as well to be here today. I stated my name is David Underwood. I am the Managing Director of Detroit Community Care Network. We are a faith-based organization that's made up of member churches. There are 12 churches that make up our organization, and we serve those in our community in need, connecting them to programs, services, resources, and information that has a positive impact in their lives. As you have heard here today, one of our key core values, main core values of DCCN, that's what we call ourselves, is collaboration. Since 2018, DCCN has worked to build partnerships with community-based organizations, healthcare, government, corporations, foundations, and academic institutions to address the health and well-being challenges facing our community members, because we believe that true progress comes from working together. That's why this day is so significant. Wayne State University has long been more than just an academic institution. It is a vital part of Detroit's fabric. Its commitment to the community is woven into everything it does, from education to service and to research. We at DCCN have seen firsthand the positive impact of this dedication. I first reached out in 2019 to Patrick Lindsay. He was the Vice President of Wayne State Community and Governmental Affairs. And I just wanted to have a conversation about how Detroit Community Care Network may partner with Wayne State in some meaningful way. And that conversation led to me meeting Dean Stephanie Hartwell of the School of Liberal Arts. And Dean Hartwell, she just embraced our work. Tremendous woman, and she began supplying DCCN with interns from the School of Public Health. And during that time, the pandemic hit us, right? Well, we didn't stop serving. We kept going. Even though the interns left, we still partnered. And then we partnered with the Wayne Health mobile units during that time to help make sure that vaccinations and healthcare services were still at reach for those in our community. And we started bringing the mobile unit out to our church parking lots and partnering all over through Metro Detroit. And during that time, I was introduced to Dr. Phil Levy, who heard about our work, and he embraced our work. And Dr. Levy not only embraced our work, but he supported the expansion of our work, and that's why we went from 1 church to 12 churches. And Dr. Levy then introduced me to Dr. Nate McCautry, who was the director of the Community Health Worker Academy at Wayne State University. He says, let me see this curriculum you're training your team in. When he seen the Transition to Success curriculum, he was blown away and said, hey, everybody that completes your program, I'll give a free scholarship to become a state-certified community health worker. Guess what? Today we have 42 Transition to Success trained coaches and 27 state-certified community health workers, giving of their time and talent to serve our community. And then along the way, I met Dr. Ijeoma Opara, a committed advocate for public health, who who invited me to join her Detroit Race-Based Medicine Task Force. And through these efforts, I was introduced to Dr. Haley Thompson, who was instrumental in my being here today. Dr. Haley Thompson is a great champion for DCCN. She was instrumental for DCCN partnering with Karmanos Cancer Institute, its community outreach and engagement organization, where now our community health workers are serving the community by providing cancer education and community engagement activities on behalf of Karmanos. So you see, I'm truly a witness to the impact and the commitment that the university has within our community. And this beautiful new health science and research building is a testament of that commitment. It is more than just bricks and mortar, as you have heard. It's a promise, as you've heard. It's a promise of innovation, a promise of discovery, and more importantly, a promise of a healthier future for our community. We are particularly excited about the building's community engagement component. This space will open doors for collaboration, which I just spoke about, right? Allowing organizations like ours to partner more deeply with brilliant minds at Wayne State University. It will create a powerful link between research and real-world application, ensuring that scientific advancements directly benefit the people who need it most. So today, we are not just cutting a ribbon, we are opening a new chapter on partnerships, possibilities, and progress for Detroit. And on behalf of DCCN, I want to congratulate Wayne State University on this incredible achievement, and we look forward to the great work we will accomplish together within these walls. Thank you.
Ladies and gentlemen, now please welcome Dr. David Rosenberg, the Acting Dean of the Wayne State School of Medicine.
Good afternoon, everyone. It's great to see you all here. Knowledge heals. It also defeats ignorance and stigma, and that's exactly what the Wayne State University Health Sciences Research Building is all about. I'm a proud native Detroiter. I grew up very close by in the Lafayette Park Co-op. And right now, I just believe this is our moment, because one of the things that I've been aware of since coming back to Detroit is that Wayne State is intricately involved in Detroit's renaissance. And this building means something special for us. It means the best and brightest physicians and scientists, cancer specialists, biologists, immunologists, neuroscientists, metabolic and infectious disease experts, and their students, all working together side by side, targeting those diseases, those illnesses, and those healthcare disparities that most impact Detroiters and Michiganders. I like to think of what Albert Einstein used to say, that logic can take you from point A to point B, but imagination, that takes you everywhere. That's what this is all about. Exciting times ahead, my friends.
Ladies and gentlemen, please welcome Dr. Boris Pash, Chair of the Wayne State Department of Oncology and President and CEO of the Karmanos Cancer Institute.
Good afternoon. It's an honor to be here on behalf of the Barbara Ann Karmanos Cancer Institute and McLaren Healthcare to celebrate this important milestone. Our affiliation with Wayne State University has been central to Karmanos. It is one of the reasons why Detroit is one of the only 57 NCI-designated comprehensive cancer centers in the nation, and the very first one in Michigan, if I may say. This makes Detroit, though through Karmanos, not just a home for great care, but a national leader in the fight against cancer. The new health science research building deepens that bond. It will house labs where oncology research advances alongside other critical disciplines, driving the breakthrough that ultimately improve patient care. Mayor Duggan mentioned the story of AZT. There are several more. Karmanos has been actually the site of the testing of many new drugs that were tested here first prior to anywhere in the country. Theranostic is one, with Pluvicto being the known drug. We know that our community faces higher rate of preventable disease and cancer disparities than many other parts of the country. We see those realities every day, and we take seriously our responsibility to change them. By bringing together scientists, physicians, and trainees in the state-of-the-art laboratory, the discoveries made here will directly address the needs of our community, reduce disparity in care, and bring healing and hope to families. This building will also mark an exciting new era for cancer research. Traditionally, it takes about 10 to 15 years for research to reach patients. Together with Wayne State University, Karmanos is committed to shortening that timeline, getting the newest treatments into the hands of Michigan families sooner, and setting a new standard for how science transforms patient care. Karmanos already runs more than 250 clinical trials, many not available anywhere in the country, and we're involved with nearly 70% of all new treatments approved in the United States for cancer treatment. In fact, we often provide patient access to those therapies several years before they are commercially available and fully approved by the FDA. Again, this new facility will only strengthen that advantage by accelerating the drug development timeline. This ensures patients across the state within our network of 17 cancer centers from Petoskey to Port Huron throughout Metro Detroit and Southeast Michigan and Greater Lansing benefit from discovery happening right here in Detroit. This is where tomorrow's cure began. This project embodies our shared vision, research that doesn't stay hidden in journals, but translates into therapies, technologies, and innovation that change and save lives. On behalf of Karmanos and McLaren, we're proud to stand shoulder to shoulder with Wayne State University and all of you in making this vision a reality. Thank you.
And now, to close our program, please once again welcome Dr. Ezamanari Obasi.
So in closing, I want to thank our project team. As you can see, this is a beautiful building, and it took a lot of bright individuals to make this happen. This includes our owner's representative, Kramer Management, HKS Architects and Designers, Osborne Engineering, the Chrisman Company, and Wayne State's Department of Facilities Planning and Management. And also a special thank you to the faculty and university leaders who supported our project team. We are grateful for the great efforts that they are putting into this project to help bring this vision to life. I also want to thank all the speakers and guests who joined us today to celebrate this historic moment. If I can now have all of our presenters, media, and guests to move over to the adjacent sandbox over here, and we'll get started in building the future of our new health science research building. Thank you.
I'll wander back over here.
Well, put your shovel in. Now I say 3, 2, 1, then toss.
Toss it with.
3, 2, 1, toss. Woo!
Yeah, but we're just get a quick picture right here in the middle of that. 3, 2, and 1. Thank you. Anybody else? We're good for me. We're good? I think we're good.
Wonderful.
Thank you.
The building is christened. Yay! Or broken, or whatever.